3 then, you were looking at the values and behaviours that we should expect staff to demonstrate in the NHS. Who's going to be back on this one? A little bit of a battle here about who's going to do it.
So we're going to share.
I'm going to kick it on someone.
We're going to share it. We're going to
I'm
share.
going to kick off then, Joan, and
I'll kick off.
Suzette can come on.
I'll kick off by, so this issue of responsiveness, let me put it like that. If we were rewarding organisations on their responsiveness to people using services, and we were actively saying that's the important issue. So, go out and proactively seek complaints, as John Lewis does, and seek what people are saying and use all kinds of different methods, and then tell us how you have responded. Because it might be kind of tricky to kind of say, well, have you resolved it well or not as an NHS organisation? But that shows a different kind of metric in relation to patient experience. Some of our points were answered by the question at the back, so I'm going to move to Suzette now.
Okay, me again. Suzette Woodward from the National Patient Safety Agency. Actually, we did have some of our thunder stolen because I think Jim's point is brilliant, and that national bodies should make a public commitment together about what is needed in this respect. We did talk about a number of issues, and this is something that I raised, which was in relation to the NHS brand, and is there one? And currently there isn't, and we talk about individual organisations doing their own thing, which is fabulous and fine, and does get some bottom-up ownership of things, and some people work very hard to get that bottom-up ownership. But actually, why? Because we're all delivering care to patients, and why don't we have exactly the same values throughout all of that? We talked a lot about the, as I call it, the just culture, and others call the learning culture, and how important it is to have a consistent approach for all staff. So if they're expected to embody the right values and behaviours, which is set right from the top, then we need to be able to treat them consistently and fairly when they are working through those values and behaviours. We liked the examples of things that from this morning in relation to reward and recognition. We liked the things from this morning in relation to recruiting to behaviours and values, and the using those values and behaviours to act instantly to problems, and owning those problems and having clear guidelines as to how to do that, and how the positiveness around the reward and recognition of staff clearly must have an impact on the way that they are treating and caring for their patients. And what else? And we also talked a lot about driving through measurement, and how that definitely we need to know that this is changing, because we've had too many times this, which other people have mentioned, top-down approach to staff, and then it's kind of left at that. How do we genuinely know those values and behaviours are sustained? We need to measure it.
In other seminars, we've heard the suggestion that there is an NHS Code of Conduct for managers. I think it was 2002. Should there be a Code of Conduct for all NHS staff that's built into their contract of employment and embodies some of these things around not only values but the behaviours that are expected and also unacceptable? Is that something that you'd like to see?
We did touch on that in terms of the NHS brand, and actually, although there's lots of individual NHS organisations, there's one NHS, and actually is there something that we can build into patient experience, being built into the commissioning process, and the core values then actually disseminating through. So it is a staff responsibility, it's also a patient responsibility, and it's an organisational responsibility. So how do we change the idea from blame and individual to actually, it's everybody's responsibility, and it's really important to build it into the system.
Patient experience is everybody's.
Everybody's.
Okay.
Sarah.
All right. Yeah.
And if people took notice of the NHS Constitution, they find most of it's
Yes,
encapsulated
indeed.
there. We just need
Indeed.
to take it more seriously.
Well, a lot of these things are not, they become optional after a while. Is that right?
And we agree completely with the idea of recruiting around behaviours and values, but also you need to go back a step further, particularly from a nursing or medical point of view. It's actually about how people are trained. And nurse training has changed a lot over the years, and it's much more technical, a technical skill as opposed to a caring skill. So recruiting a nurse, if that's the point at which you're catching it, it's too late because they've been trained already. So it's actually about building in caring, or building it back in, if you like, and coming back to Robert's point at the very beginning about Florence Nightingale. I think that's some of the points actually that's missing.
Indeed, I think you've been listening into our conversations in the other room again, because we were talking about whether nurses and other clinicians should have experience of being healthcare assistants, for example, before they're properly trained, so they get some experience of undertaking basic care tasks. And we were also talking about perhaps having a rethink or even a redesign of the curriculum, particularly around care for older people, to catch up with the changing pace of medicine. So that are two other relevant points that come in there.
Just related to the point you just made, yesterday we heard about what appeared to be quite a large percentage of nurses who start their training and then drop out. If they did a whatever it would be, sense of training, then they may genuinely understand what it's all about and keep going.
Yes, or the contrary, find it's not for them. Let's move. Did you want to come in, Joe?
Thank you. Just the one thing I took from John Lewis was the absolute seriousness of their approach. They took themselves seriously in terms of we're here to improve the experience for customers and our staff, and therefore what follows from that is that they recruit for it, that every single person is recruited to be able to do that, and they're all trained and developed to enable them to do it. And that is what we need to do in the NHS, not leave it to people to choose to do it. We're a £100 billion business, and the consequences of failing the NHS are catastrophic, literally. So if John Lewis can do it, we should too.
Absolutely.